Hello Nation, welcome to the Edelman Report. Today we're going to talk about social media, something that's really been around for only a couple years and how it can help you take control of your diabetes. Now today is the first Edelman Report where we have a guest, and that guest is David Edelman. David, welcome to the show.
Dr. Edelman, it's a great pleasure to be here.
You know what? One of the main reasons I invited David is because his last name is Edelman. The other reason is he's one of the most prominent online members of the diabetes community and has a great blog, information network. And I want to ask you, David, what can going online to the Diabetes Daily, for example, or the Diabetes Hand Foundation, what could it do to motivate you to take control of your diabetes? And how is that better than going to a face-to-face conference, seeing a diabetes educator, something like that?
Well, Steve, I have to tell you, the answer is, it's not better. If you can have a real-life support network, that's going to be your first choice. That's great. But for a lot of people, they don't have that. You have type 1 diabetes. You probably don't know anyone in your area who has type 1 diabetes. And if you have type 2 diabetes, a lot of people don't like to talk about it. It's one of these silent things. You don't just go out to dinner and say, hey, how's everyone doing? Yeah, I have type 2 diabetes. Let's talk about management. Just typically doesn't go that way.
Yeah, and I think, we were talking about earlier that how much time do you get to spend with your doctor now? You had a good number for that.
I did the math, and it was about 0.01%. That's the percentage of your year you actually spend with your healthcare professional.
Yeah, and some of my patients, I wish it was less than that.
And some more, I'm sure.
Yeah, and some more. So what can you get from going online? Give us some examples. I know your wife has been living with type 1 diabetes. She had a successful pregnancy. And give our viewers an idea.
You know what? I think back to the story of Melissa. Melissa, around the 19th anniversary of her diabetes diagnosis, joined a website, 2Diabetes. She had gone to her doctor, and she had said, I would like to have a baby. And her doctor said, you've had...
I thought the doctor said, I'm already married. Sorry.
After that, and it's sad, he said, Melissa, you've had out-of-control type 1 diabetes for 19 years. I don't think it's safe for you or for your child to have a baby. And she was devastated. So she went online to find other mothers who had been through that and had successfully had a baby. So she actually went online, she got a plan, she figured out the treatments people were doing to successfully manage their diabetes, and she took this plan to her doctor and said, I'd like to do this. And with her doctor's help, she did it. And she had a successful pregnancy and a healthy baby girl, and is pregnant again, and actually might have already just given birth to her second child. So
that's a good story. How do you regulate the stuff that goes on a blog? How do you know some lunatic's not on there talking about some remedy that his grandmother told him, or people trying to sell snake oil, which happens all the time?
Well, you got a couple things. One, if someone's doing spam or self-promotion, commercial promotion, you have to ban them and remove them from the community. The second, you need a community ethic. You need to train the community that when someone starts to overstep their bounds and give medical advice, people step in and say, no, you can't do that. You can talk about what you do. You can even suggest, hey, you should go talk about this with your doctor. But it's a totally different thing to say you should start, stop, or change a treatment, including your diet, because that's when you cross over from being a peer to acting as a medical professional.
Well, I know you play one on television all the time, but it seems to me that there has to be fairly good policing of the information out there, because I hear people all the time, there's too much crap on the internet now, and I think you have to be smart enough to decipher what stuff is real and what stuff isn't. Do they have little seals of approval for different websites?
Not really. I would actually say one of the best things a medical professional can do, and what I wish that more medical professionals would do, is say, hey, go out on the internet and search, because they're going to do it anyways, so give them your blessing. But say, when you read something and you want to change what you're doing, call me. Pick up the phone and tell me what you want to do. And they'll reach out and do that. And that's an opportunity to establish some trust. It's an opportunity to really start a dialogue. And if someone comes in with some crazy diet, I like the acai 10 gallons of juice a day diet, you might discover or ask them, why? What is it about that diet you like? And you could find out that their current diet isn't working. And maybe there's something about this other diet that you can bring into what they're doing. And it can be the starting point for a dialogue.
Yeah, David, I think, nowadays with our limited healthcare dollar, that in the best of all worlds sounds like a great plan. And I do it, and I don't see patients 100% of the time, so I have a little more time. But yeah, and it also tells me my patients interested in their own health and they're trying to investigate things. Now, to be honest with you, David, I love your last name, but all this face-to-face stuff is kind of getting old. I want to go to your website, so good talking to you. All right, Diabetes Daily, and also the Diabetes Hand Foundation. There's Diabetes Mind. There's lots of good sites out there. So get online, nation.
That was easy.
TCOYD is a 501c3 not-for-profit organization that has been educating and motivating diabetes communities in cities around the country since 1995.